Welcome, everyone, and thank you for joining our webinar today. Harold, you want to go ahead and get us started?
Absolutely. Thank you very much. So some housekeeping. If you're experiencing any technical difficulties, call 1-800-263-6317. There you go. Q&A session will be held at the end of this presentation, so we've got time for questions. They can be submitted by the questions function at any time during the presentation. We'll kind of accumulate those. The PowerPoint presentation, as well as a recording of this, will be sent to you within about 10 days. So I have that. There is an online survey that we're going to send out, and I want to make sure everybody tries to respond to that. This is very, very important. It really drives the topics that we present at these. So please give us your feedback. It would be much appreciated. So about CLA, we are a national CPA and consulting firm. We have 90 offices throughout the country, 3,600 professionals working in the firm. We serve about 6,000 clients, and we serve about 1,000 religious and faith-based organizations throughout the country in a wide variety of either direct evangelical or religious organizations in the traditional sense, or religiously affiliated mission type of work. So we have a very large presence in the religious sector. So, speaker introductions. I'm Harold Parsons. I'm a partner in charge of our religious organizations within our public sector group at CliftonLarsonAllen. I've got about 33 years of experience in serving a wide variety of clients, but a vast majority of my clients are religious or religiously affiliated clients. And I coordinate nationally just to make sure everybody has everything that they need to do and do with this industry group. So that's my deal. And Larry is sitting right next to me.
Hi, I'm Larry Adams. Welcome everyone to the webinar. I'm in the Clifton Larson Allen nonprofit group in Minneapolis, and I work with a variety of nonprofits, primarily arts and colleges and universities, as well as religious organizations. So good to be here today. And with that, I think I'll get started on the presentation.
Well, sure you will. I think it's the arrow key.
The objective.
There you go.
What we're trying to accomplish, just to give you an overview, ACA, we're going to refer to that a lot, is the Affordable Care Act. That's kind of the law. So our goal here today is to give you a better idea of what's in that law. It's very complicated. There's many thousands of pages of law and regulation, and all the questions clearly haven't been answered, but if we can just give you a tidbit of information about what you need to know and things you need to get working on, we'll consider this a successful webinar. One of the big things that we're going to talk about today is defining large and small employers, and that's really critical to understanding from a business perspective your compliance with the law. Large employers have to comply or there are penalties. Small employers don't have to comply, so we'll talk about that. We'll also talk about some compliance timelines. One of the things that you're going to see throughout the presentation is that there's going to be many requirements upon you, and several that have already taken place, and it's going to be incumbent on you to not only to comply, but to document your compliance. And then lastly, we'll talk about the health care tax credit, which has been available since 2010, really just for the smallest employers, although we do have several clients and calculate many health care tax credits on an annual basis, and there is some money out there to be had from the government. So just to kind of get you grounded in, the health care law to begin with, this passed in 2010, March of 2010, so 3.5 years ago. It has survived 42 challenges to repeal the law by the House of Representatives. It's now being held up for, the budget extension, September 30th. But really, what was it and what did it accomplish? I mean, the goals, as you can see there, increase access to health coverage. I think just my limited involvement with the law, yes, I've seen that. Now kids are covered, no pre-existing conditions. So I think they've accomplished that so far. Reducing the cost, I think that remains to be seen as these healthcare exchanges roll out for the next year or so. I think we'll see if the insurance premiums stabilize or continue to increase. I mean, right now it's kind of across the board. We talk to organizations all the time who have 20 and 30% annual increases that they're looking at, and we talk to some that have zero, or their premiums are actually going down. So depending on who you are, what state you're in, we'll see if those costs get reduced. And then certainly to reward value-based care, I think that's more on the provider side. But the other thing that's interesting here is that the expected cost of the law is going to be $940 billion. There's some health care going on right now. $940 billion over 10 years, so that the costs are substantial. But we're talking about increasing the coverage by 32 million people by 2019. So if those numbers play out, I think theoretically you get enough healthy people on the plan that helps reduce premiums for everyone. In terms of the Affordable Care Act, it applies to everyone. All businesses, including religious organizations, almost every individual. There's just a few exceptions. If they don't get insurance through their employer, then they're required to go get their own health insurance. That's called the individual mandate, and that is effective January 1st, 2014. The reason why these healthcare exchanges, although they call them marketplaces now, I think they thought exchanges was too complicated. So these healthcare marketplaces run by the state, they're all being set up. They're going to be operational October 1st, with the insurance being effective January 1st. So the law established these exchanges. Some states will have their own. Some the federal government will do. And then another big component of the law is this large employer kind of pay-or-play penalty, where if you have 50 or more full-time equivalents and you don't offer coverage that's deemed affordable, and we'll get into the definition of that, and you don't provide the minimum essential coverage, then you have to pay a penalty, and that penalty is $3,000. And if you're a large employer out there, I mean, that's what's getting all the news right now in terms of businesses reducing workforce and things like that, but that whole provision got delayed for a full year, so it's really not effective until January of 2015. But as you'll see in this presentation, there's still plenty of things for you to do. There are special considerations for religious organization. Who's an employee? Who's the insurer? Who's the organization? We'll discuss all those things in a further slide, but the big thing to know is that while there are many questions and many answers, everything isn't resolved yet. Regulations are still coming out. Provisions in the law have been delayed and still need to be formalized. So ask your questions, try and figure out how they apply to you, and try and comply the best you can. I think that's what the goal is. In terms of, just to give you kind of a let's get grounded in what's happened here over the last 3 years. We have this slide that kind of has a timeline on it that shows, how far we've come in healthcare reform. If you remember back in 2010, now that it's 3.5 years ago, that's when the tax credits came in. That's when you can no longer deny someone a dependent for pre-existing conditions. That's when dependents could be covered. Now that's starting to be old hat with us, but 3 years ago, the dependent coverage wasn't up to age 26. In 2011, they got into these medical loss ratios where if the insurance companies weren't spending the proper amount of money, they actually had to refund some money. So that kicked in 2011. And over-the-counter medication wasn't reimbursable anymore for flex spending accounts. One of the things that you have to keep in mind is that $910 billion is going to have to be paid for somehow. So some of the provisions, like that flex spending provision, effectively increases taxes because people put less into their plan. So, and then in 2012, you're required to do the summary of benefits coverage. There's new fees. We're not going to get into the fees too much in the presentation today, but there are actually many new fees that some will be paid for by the health insurance company, and some will be paid for by you on a per participant basis. But even if your health insurance premium per se were to stay flat, your costs would go up because of all these additional fees that are going to be added to your premiums. Then we get into 2013, large employers, so at the beginning of the year, had to disclose on the 2012 W-2s what the health insurance coverage was, what to each employee. I think the idea there being if people understand, then they'll have a better appreciation for it. Limits on flex spending accounts, the Medicare tax. If you're over $200,000 as a single individual, the Medicare tax went up by almost 1%, and that's on only the employee share, so that's effective in 2013. Then things we still have to look forward to. Well, next Tuesday, these exchanges are supposed to be operational, so I'm sure that'll be news as to, certainly some will stumble out of the gate and some will do a great job right out of the gate, and we'll just have to see how that works out. But October 1st is your first shot at going on a site, putting in your information, and seeing what your premiums might be. Also, there's individual penalties that are kicking in 2014. So if you're an individual who's not covered by your employer and you don't get health insurance on your 2014 individual tax return, you're going to be required to self-assess a penalty, and there's flat dollar amounts or 1% of your income that you're going to have to pay to the government. Again, another way to kind of the hammer approach to force people to get health insurance or pay a penalty. And then the other thing in 2014 is guaranteed issue, where insurers have to provide health insurance for people. They can no longer say, I'm excluding you because of health reasons or age reasons or whatever. They have to provide health insurance, and they have to renew you. And then lastly, this provision where you have to offer insurance coverage within 90 days, and we'll talk about that more. And then further on to the future, 2015, that's when the penalties kick in. I think we'll get all of the media attention again as people try and plan for trying to minimize their costs or trying to figure out what the right amount of future costs will be. Large employers in the future will be able to auto-enroll, where you could just, when you hire someone, you stick them on your plan. And then in the near future, small employers are also going to have to report health insurance costs on the W-2s. And that is still pending the exact compliance date, but we expect that in the near future. Also in the future, large employers will be able to use the exchange. I think if you think about it, the whole goal here is to turn this from a defined benefit plan, which basically what health insurance is now. An employer goes out, arranges coverage, and then all the employees have to pay for it, so there's a benefit there. That the world may shift more towards a defined contribution plan where you give employers money and they go to the exchange, or they're able to choose from the exchange plan. So having large employers being able to use these state exchanges will be interesting to see how many people take advantage of that. And I think it'll largely depend on coverage and premiums. So then the last thing in 2018 we're also going to talk about is the Cadillac tax. I think most people think of the Cadillac tax and think this is for union plans that have $1 coverage and no deductible, but the reality that we're seeing in the marketplace is with increases in coverage, average employers are now facing potential excise tax through the Cadillac tax, and it's an onerous tax, so it's something that you have to keep your heads up for.
Okay. Throughout this conversation, there's a lot of provisions that refer to the insurance company, the employer, and the employee. And there's different provisions for each. There's taxes to be paid. There's compliance for each one. And it is very important, we want to put this up front, it's very important for you to know who is who. And it is not always exactly clear when you are working in a religious organization. Up to the right-hand side of this slide, it's a lot of dioceses or denominations or synods or conventions will have plans. They are sometimes offsetting some of that risk with an insurance company, sometimes not. Are they self-insured, fully self-insured? But the important thing, I think, that we want to communicate is you need to consult with your carrier. If you have another carrier, if you don't have another carrier, you are fully self-insured. But make sure that you know exactly who is going to comply with each provision. Good faith effort is what's being looked for from the government. So if there's a notice that has to be provided by the employee, by the employer, make sure you understand who the real employer is. Because even between the church and the diocese or denomination sometimes, it is not always necessarily clear for which provision the employer would be. So I just wanted to bring this up right up front that there are some fuzzy lines here that you need to look at and you need to talk about and make sure you absolutely understand who's responsible. What can happen is that whole provisions and whole compliance provisions basically drop through the cracks. So this is already passed, so this should have already happened. So we're going to assume this has happened, but there's a summary of benefit coverage notice to employees. It's effective for plan years beginning after 9/23/12. So this would be, for example, plan years that began January 1st, 2013, or plan years that began, for example, 7/1/2013. This is your plan year, not the fiscal year of the organization, but the year of the plan. Most plans are on a 12/31 basis, but not all plans. It includes a whole bunch of other things, including open enrollment materials. You have to distribute to new eligible employees. The Department of Labor has a 6-page template that you can find. There's a web address here, but you have to document that communication. So you need to keep that and make sure that it's well documented. If anybody comes back looking for it, you will be very happy that you have that documentation. So eligibility for health insurance exchange notice. This is going to be required and is required coming up. Employers have to notify employees upon effective date or on the date of hire. It is very important to understand who issues a W-2 and who is going to do this. So in some dioceses, for example, all employees are under the same EIN number, but churches are considered the employer because they're raising the money to pay the individuals. Make sure you know who's responsible and who's going to comply with this. It's for current employees. These notices have to go out prior to October 1st, so you got a couple days to get this done. And for new hires, so this is anybody hired after 10/1/2013, the notice must be provided within 2 weeks of hire. It applies to everybody, full-time, part-time, you name it. So you have to be able to document that this has taken place. Employers who are subject to the Fair Standards Labor Act have to comply with this. Hospitals, institutions who care for and risk-aged, schools for children, preschools. There's some might not believe churches, might not necessarily, depending on their size, might not be subject to the Fair Standards and Labor Act. Others have been told that they do. Fair Standards Labor Act definitely applies to churches in certain cases and not in others. For example, you have to pay time and a half. But actually, the provisions of the law are, even if you don't believe you necessarily have to comply with the Fair Standards and Labor Act, it is a good practice because on the next slide here, you do want to inform employees of what their coverage is and coverage options are. So the Department of Labor has a model language that's available on its website that you can go to, you can look at. Obviously, these are both examples, and they may need, well, they definitely will need some modification if you're going to send one or the other out, but they're good starting points. So, defining full-time equivalents for religious organizations. Lay employees. It's usually easy to determine who your employees are if they're lay employees, but we look for, first off, employees. For the most part, if the church is providing the W-2, they're going to be considered statutory employees of the organization. If the W-2 is coming from another entity, there's going to be some question on who's the employee. But for lay employees, ministers, religious workers, you need to know who your full-time equivalents are. So, and in different provisions of the law, they are counted differently.
Now what we'd like to do is we just have one polling question. We want to get a sense of the size of the organization that we have on the phone today so that we can tailor our remarks accordingly. So just a really simple question. What size is your organization based on full-time equivalents, assuming a 30-hour work week? You know, in the law, one of the things that they do is say you have to provide coverage for people who are over 30 hours. That's considered full-time. So please select one of the following options: that we're way below 50, we're right around 50, or we're way above 50. So if you can answer that, and we'll just give it like 10 or 15 seconds for people to answer so we can see what the results are and move forward. So. And if you don't know, that's okay, just guess. So the results, we have 43% far below, 22%, and I think those are the organizations that are going to have the biggest challenge in terms of evaluating the law, and then about 35% far above 50. So we have a good mix of organizations across the board, and we'll be covering those in detail as we go.
Okay.
So the next slide talks about just that. How do you define large and small employers? And really there are 4 different definitions depending on what context you're talking about. When you're talking about the penalties, we're talking about employers who have 50 or more full-time equivalents, and again, that's 30 hours a week of service. Or if you look at it in a month and divide it by 120, that's how you get to the full-time. That's a different definition for those who qualify for that tax credit. So for the tax credit to be a small employer, you have to have 25 or fewer full-time equivalents with an average wage of $50,000 or less to get the credit. Eligibility for the SHOP. So the SHOP is for the state health exchanges, there's a program where small employers can utilize your local state health insurance exchange as your health insurance plan. So there'll be a separate part of the portal or the website that relates to buying health insurance as an employer. That's in Minnesota, it's 50 or fewer that you can do. In some states, it's 100 or fewer. It just depends on what state you're in. And again, as a foundation for all this, where your employee lives is what state exchange you need to follow. So if you have employees in multiple states, you have multiple states that you need to follow. And
I just want to bring one thing up on this slide. This is not FICA employees. These are statutory employees. And this is where religious organizations may get confused, but ministers don't pay FICA normally, and they are not considered FICA employees, but they are considered statutory employees of the organization. So they count in this calculation. The same would be true with religious workers. Even if you're paying their order, a stipend for them to work, they are considered your employee for this calculation, even though they may get coverage through another organization. But they would be considered employees for statutory purposes.
And then the last category of defining large and small would be, in the future, if you have over 200 employees, you're going to be required to auto-enroll your new employees into the plan, so that you have that to look forward to. In terms of the health care credit, we don't have a ton of clients, and we're not aware of a lot of people who qualify for this, but for those who do, it can be a pretty meaningful dollar amount that you can receive. I mean, basically how it works is if you have 10 full-time equivalents who are making exactly $25,000 each, you qualify for the maximum credit. And you have to remember, in a religious setting, that ministers and religious workers, you exclude their wages, but you include them as a full-time equivalent. So effectively what that does is drives your average wage down and allows you to qualify for more. And we say that it's going to affect only the smallest employers, but, like I said, it depends on the situation. If you had a lot of seasonal workers that you could exclude, then you might qualify for it as well. This form is it's called 8941, and it's a fairly complicated form, as you can imagine, with the IRS, but it gets attached to a 990T. The 990 is a tax-exempt tax filing. Many religious organizations don't file a 990. You don't need to file a 990 in order to file a 990T, and then you might be asking yourself, well, why would I do that? Well, the credit is refundable. You actually get the cash, so you don't have to worry about having to pay tax to offset it.
So we filed approximately, several hundred of these returns for religious organizations. Religious organizations are one of the few organizations that they consistently will qualify because of their pay rates and the fact that ministers don't count for part of the calculation. So our average refund is $4,000 and per year. And that's average, of course. The good way to determine whether you potentially could be eligible, you can look on the box 3 of your W-3, and you can go back to 2010, 2011, 2012. Look on your box 3. If it's less than $650,000, there's a good chance you could qualify. And really, the organizations that qualify can actually be very, very small. So we've gotten decent refunds for organizations that, or churches, I should say, that are have FICA wages under $50,000. So, and you can go back. There is no penalty for late filing at this point, because penalty is based on the taxes you would pay, and obviously what this is you're just getting a refund, so there is no taxes owed on the form.
So the credit, in terms of determining the credit, it's a percent of your health insurance premium. So right now, for the years 2010 through 2013, you get a credit equal to 25% of your health insurance paid, subject to a phase-out, depending on how many employees and what your average wages are. That credit is set to go up to 35% in 2014, with the caveat that in 2014, you have to be on a health insurance exchange in order to get the credit. And you get it for 2 years once you're on the exchange. So as Harold mentioned, you could still claim prior years. If you weren't aware of this, if your CPA or whoever's doing your book work wasn't aware of it, you could go back and calculate it and file amended returns or file a 990T for the first time and get that money. If you do happen to pay unrelated business income tax, you can apply the credit to that. But if you don't, you can get the money. They'll just send you a check in the mail, and it's just as simple as that. And we have to note that, because of the sequestration, for some reason, the government decided that nonprofits should get 8.7% less of this credit, so they're really the only ones who are affected by it. But if you did calculate the credit on the form, the government would actually send you 8.7% less.
Okay, pending implementation, fully insured plans can no longer discriminate. The penalties for discrimination aren't really been announced. This has been delayed until there's further rules have came out. But be aware that we have every expectation that those rules will come out. And what this means is that you cannot pay 100% coverage for single for one employee and 80% for another employee. And that is discrimination and under the statute, and you would no longer be able to do that. That actually is quite common in religious organizations where ministers or priests will have a higher amount paid for single coverage, and in some cases they don't even offer it to lay employees, or the lay employees would have something less. But we've seen it where they have different coverage for different types of employees. That is discrimination, and once this is actually effective, then you should be aware of it. But the penalty would be significant once this goes into effect. So stay tuned. Be aware that this is coming down the pike, and you'll be responsible for it. Health plan fees and taxes. So Cadillac plans. I think that one of the important things here to realize is that it is not based on really luxurious coverage. It is only based on the cost of the plan. So if you have, for example, a large number of demographically older people in your plan, let's say a plan where you're covering essentially ministers, they may be older. You may actually have not so wonderful benefits, but they could be very easily fall under the Cadillac plan just because it's an expensive plan. So that would trigger the Cadillac plan tax. So 40% excise tax assessed on health insurance or plan administrator offering high-cost health coverage. So there'll be a tax coverage, $10,200 for single coverage, $27,500 for family coverage, and this takes place in 2018. And we have seen premium increases. So when this first came out, I thought this is not very likely that we'd see many, and I have totally changed my mind. I think we will start to see more and more plans that could potentially end up in this Cadillac plan category by 2018. Insurer reporting requirements. Again, this is so you know who the insurer is. Insurers must file IRS information returns for coverage provided to full-time employees, and this is based on the IRS's definition of full-time employees, not what you would normally think of FTEs. We got a definition in a later slide on that, but after 2015. So the first return is actually filed in 2016 for the fiscal year 2000, or filed in 2016 for the fiscal year 2015 information, and includes information on who is covered, when the plan is in effect, if the plan is in the exchange. There's additional information. Churches are not exempted from this. So, you know, and I want to just reiterate that all this stuff does not exempt churches. There's only one little window where churches and church affiliations are exempted, which under this law that which is on offering certain benefits, which employees will still actually receive those benefits. But this does not exempt churches, by the way. So you would normally include this with your W-2 information that you're providing to your employees. Individual mandate penalties. So effective in 2014, this has not been delayed. So large employer penalties have been delayed, but the individual penalties for people are not going away. So penalties for failure to obtain coverage is the greater of 1% of your household income, or $95 per person, and that will be paid on your income taxes. So if you have people that don't have coverage, they will have to pay that penalty. So family penalty is a little bit different. Independent assessed penalty is half of the per person rate. So it can add up pretty quickly, and it can be substantial if particularly with higher paid individuals, but which is pretty rare in a religious organization. But these penalties have not been delayed, and they apply to everybody.
So let's switch gears for a second and start talking about the state health insurance exchanges, or marketplaces as they're calling them now. Several states, including Minnesota, has active exchanges. Basically what it is, if you haven't gone out on the internet and kind of surfed around to see what was available, the intention is that it's kind of a website. And I always heard the analogy like buying an airline ticket where you enter your information, but I think of it more like completing a mortgage application, because you're including a lot of personal information, your income, your dependents, all that kind of information is going to be put into the website, and then it'll decide what credits are available to you, what plans you can choose from, and will allow you to compare plans. In 2014, the state exchanges that kind of have the more robust exchange at this point will have the ability for small employers to go in there and have multiple options. I think on the federal-based exchanges that, and we'll see that in a minute, there will be more limited options. I think they delayed it out a year So the small employers won't have as many choices as some states that have exchanges. But I think you should Google whatever your state exchange name is. Hopefully you know the name of it by now. You can go on it. Certainly after October 1st, it'll be available for kind of playing around and seeing what's available. I know in Minnesota, here they released the rates 2 or 3 weeks ago, so they actually have the premium rates out there, so you could see coverages and rates and compare those to your plan. In Minnesota, at least, it's based on county, so depending on what county you live in will depend on what plans are available, what your options are, and things like that. So this whole thing is kind of a work in progress. I think as the federal government gets up to speed and as it all comes together, it'll be really interesting to see how operationally effective they are when they roll out. The next thing are the type of exchanges. Like I said, in Minnesota, we have a state-based exchange where the state basically made all the decisions, runs everything. Certainly, it will have to link with the federal exchange. If you can imagine this big database in the sky, Harold talked about employers reporting their plan information. The IRS will report income information. Social Security will report, Department of Labor. They'll kind of match it all up and see who is complying with the law and who is not. And then I suppose sometime, let's see, if you file a 2014 individual return by the middle of 2015, maybe 2015 or early 2016, penalty notices will start coming out by the IRS for the people who either didn't self-assess or employers who don't have the proper coverage or not covering people in the right way. So it'll be interesting to see how that goes. But there's also this kind of quasi-exchange that it's a state partnership exchange where the state really is more involved in setting the plan and having the government do the rest. And then there's, we have many states where, for whatever reason, political or otherwise, they have deferred from trying to be involved in health care reform at all. Then the federal government is going to come in and set up the exchange and take over and set up the plans. And I think that's one of the reasons why Minnesota decided to have its own plan or its own exchange is because they wanted to have a greater role in determining what coverage and plans were available. Speaking of plans available, one of the things you're going to hear about and kind of the vernacular, if you will, is, it's these medal plans. If you think about Olympic medals, so there's a bronze plan that has 60% of actuarial value. And again, that may or may not be a new term to get used to. Actuarial value basically means, if it's 60%, then the plan pays for 60% of the benefits and the employee pays 40% either through deductibles or co-pays or co-insurance. So this actuarial value is kind of going to be how everything is going to be based going forward, and it also dictates the cost. Obviously, the more that's covered, and you can see in this slide, you have the silver and gold and platinum plans. I would fully expect the platinum plan to cost a lot more on a premium basis than the bronze plan because there's more coverage there for you. And I think they threw in this catastrophic plan for those final resistors who said, I'm not getting coverage, so they made it cheap enough to say, if you're under 30 years old and you don't have any other plan, you can get this cheap plan that will provide the minimum coverage and 3 primary care visits a year. But all the plans at every state level, they have to cover the essential benefits and have those certain actuarial values. So on the exchange, how do you participate? Well, there's two channels to participate. First, employers can participate. Initially here, October 1st, which is next Tuesday, small employers, which, again, depending on what state you are, might be 50 or fewer, or might be 100 or fewer, can offer these plans as their own plan. So they could go in and choose and make that their plan. In 2016, that number goes up to 100 or fewer, and then in 2017, states can determine if they want to allow everyone, even large employers, to get on their state plan. So that's the employer channel. And then the other way are for individuals. So I am working out of my home, or I have a job that doesn't provide insurance, and I know I need to get it or else I have to pay this penalty. Well, then I go to the website, same drill, you enter all your information, and it's kind of verified, and They determine what credits you're available for, and you decide if you want, what level of insurance, and go from there to purchase the health insurance that'll be effective January 1st, 2014. So we talk about exchange trends. What are we seeing so far? It depends on the state. Like for example in Minnesota, because I'm based in Minnesota, so that's nearest and dearest to my heart. The SHOP Minnesota plan. You're going to see the same kind of insurers that you see every day who are offering private plans. On Minnesota website, the small employer coverage is Blue Cross, Preferred One, and Medica, depending on what county you live in. But it depends on the state. It depends on the county. It's really up to you to go out there and see what's available. At this point, we still don't know what that national, if there's going to be a national plan offered on the federal exchanges, but I guess that remains to be seen. And really, again, depending on your state, will depend on the rates. Again, in Minnesota, the early analysis is that the rates are the lowest in the country, and I think that's due to the Minnesota board that governs the plan saying, this is what we want, and maybe the insurance companies came back to them and they pushed back and said, we want lower rates. And so some states may accept the rates right out of hand, and some states may try and push for the lowest rates.
But the rates can vary by a factor of 2 in Minnesota, even depending on what county you're in. So it's not uniformly what we call cheap.
So continuing on this small employer option, here are 5 models that are going to be out there. Whether, number 1, you want the employee to choose any plan, any level, whether you as the employer will choose, bronze or silver or gold, and then the employee can choose a plan within that tier. Whether you just have one plan that covers multiple tiers, whether you select the tier and then let them choose, or have you choose. This is going to be the plan, and employees can enroll or not enroll. So there's going to be lots of options out there. Oh, and here's the slide. Sorry about that. So now here it's going to talk about large employer penalties.
Now, the large employer penalties are based on the government's definition of what you are as a large employer, which we have, but they've been delayed 1 year. And it does apply to religious organizations. So the fact that your religious organization doesn't mitigate this at all, you still potentially could have penalties assessed. There is going to be difficulties, although if you have multiple organizations that you would consider separate employers that are functioning under the same EIN number, because the EIN number is how information is going to be initially accumulated by the federal government. You may be able to do other things with that, and there's some rules that should be coming out on that, but this is going to be just to be a difficulty in record keeping, so we want you to be aware of that. But to kind of start out, large employer, there we go, large employer. On the right-hand side, this is a very peculiar method. I just want to bring that up. It is not what you and I would normally think of as how you calculate full-time equivalent. So anybody with average 30 hours or more per service per week is a full-time equivalent. And then you take everybody else, and the hours worked in a month by part-time employees is divided by 120. So you will come up with whether you've got full-time equivalents in this manner. You absolutely need to know how many full-time equivalents you have all the time. So if you're on the cusp of being over or under, it will make a difference to you. So you should know. Next slide, employer shared responsibility penalties. So penalty once assessed, if a full-time employee receives exchange subsidies, you're going to foot the bill. If you don't offer coverage, you're also going to pay $2,000 per each full-time employee. That is not the full-time equivalents, but the full-time employees. This is the people that are working over the 30 hours a week. But no matter what, you'll never pay over the 30. Now, the first 30 employees are free. So let's say you have 60 full-time equivalents, and you don't offer, not full-time equivalents, but full-time employees, the first 30, and you offer no insurance whatsoever, you get $2,000 per employee penalty, but the first 30 are free, so the second 30 you're going to pay that $2,000 penalty on. Okay, the delay. What does the delay mean? There really is no need to offer full-time employees, dependent children, minimum essentials for affordable coverage in 2014. There's no penalties if coverage offered is unaffordable, and you don't have to file the information return with the IRS in 2014. So that was what was driving the need for that IRS form. Control group rules. For churches, this is going to be a little bit difficult in some cases, but control group rules are generally, IRS has not determined how the rules should be applied necessarily to churches. The control group rules have generally exempted churches if you dig far enough into the rules. And I also want to just bring up that there's actually 3 approved healthcare sharing ministries in the country. That's the only ones that they will ever approve, because they had to be formed years and years and years ago to qualify, and there's only 3 of them. So,
we have about 12 minutes to go for the end of the webinar, and so if you're thinking of questions, feel free to type them into the chat box, and when we get done at the top of the hour, we'll be answering questions. So what do employers still need to do? As Harold mentioned, they have to give the exchange notice by next Tuesday. They have to provide benefit summaries, and they have to make sure that they offer this insurance within 90 days of when people start. So for individuals, what does that mean? What does the delay mean? And it really means nothing. The insurance exchanges are still going to open up. The one kind of wild card here is that you shouldn't be afraid of penalties. It's possible that some of your employees can get better credits and better coverage on the exchange than you can offer to them. So if you haven't analyzed it, you're going to need to analyze it and say, is it worth it for us to pay a penalty, pay our employees more taxable compensation, and let them go get their own coverage? There are situations where that's the case depending on how much your employees earn and where they fall in the credit scheme. Individuals who earn between 100 and 400% of the federal poverty limit. So for a single individual, that's $15,856 up to $45,960. Those people are going to be eligible for government subsidies on their health insurance premiums, which obviously is something that you can't offer. Mm-hmm. In the interest of time, I think we'll skip over this 90-day waiting period because we've already talked about that. Identifying full-time employees, Harold's talked about that based on hours of service. For salary, it's easy. For seasonal, if you work 120 days or fewer, then you're not part of the calculation, and that's the same for the health care credit. The full-time employee safe harbor, the reason why we have this, it's a little complicated, but basically you measure how many full-time equivalents you have during a certain period of time, and then once that is kind of documented, you can rely on that measurement for what's called the stability period. So, for example, if you use 2014, which I think a lot of people will do with the penalties delayed, use the calendar year 2014 to measure how many full-time equivalents you have. Once you determine that, then that calculation is good for the year of 2015. If you can use a shorter period, but then the stability period is shorter, 6 months, for example. If you use 6 months, then it's only good for 6 months, so you have to kind of re-up on this calculation. It's fairly complicated, but it's good for you to understand what the safe harbors are in terms of, once I've calculated this, how long am I good for? So we talk about strategies.
So for 2014 and beyond, strategies for large employers. Again, defining which employees are full-time is critical. What is important, you must offer full-time employees and their children under age 26 health insurance coverage. It's a pay-or-pay penalty. This is down the road, obviously, not 2014, but 2015. And going forward, the penalties would have to be paid. But again, mathematically, it may work out better for both the church and the employees for you not to offer insurance. And it's just the math of it, and we've got a slide on that.
The other thing to be aware of, and I don't know how true this will be or not, but I've heard a number of people say that, and I'm not an attorney, I'm a CPA, but that attorneys are kind of licking their chops here because people keep talking about reducing people's hours to eliminate them from benefit coverage, and apparently there are some laws against that, and there's this feeling that there's going to be a lot of challenges to employers who do that. So if you're going to do that, I would suggest you contact your attorney and make sure what you're doing is in line with the law.
Okay. A minimum value plan. So the law requires large employers to offer at least one plan with a minimum of 60% actuarial value, which has been explained. What that means is that basically the plan is the 60-40 coverage. IRS is to make the actuarial value. They're supposed to make that calculator available to people, and so that would be the bronze plan. That if you paid 100% of the bronze plan, that's considered affordable coverage. Three employer affordability safe harbors. And it's again for large employers. The employer would not pay a penalty for that employee if you do offer affordable coverage. The employee would still be eligible for premium tax credits if they went into the exchange themselves. If you put them into the shop yourself, they're not going to be eligible for those benefits.
Basically, you look to the employee's W-2. If what they're paying is less than 9.5% of their W-2, you've got a safe harbor that you meet, and you don't have to worry about missing out on the affordability penalty, and then you have to look to the essential benefits coverage penalty.
Yeah, so a quick calculation. So if you pay $15,000 a year and they only work 30 hours a week, which is not unrealistic for in a church, 9.5% is $1,425 or $119 per month. So if the employee is paying more than $119 a month in that scenario, it would not be considered an affordable plan.
Let's skip ahead to strategies for small employers. So one of the things that you have to look at is, obviously, like we said, go to your state, look on the website, see what's available under the shop, look to see if you're eligible for health care credits that are refundable, and then you have to estimate, what's the exchange versus my health care credit and me providing the employer insurance. Like I said earlier, we're really looking at going to a defined contribution strategy as opposed to a defined benefit plan. The other thing about I'm going to skip over that slide because we already talked about that. You have to figure out how you're going to go about this. And the number one thing I would suggest is that you really, create a file that's healthcare reform compliance. And that would be a hard copy file where you're printing out emails and notices and things like that. If you think about penalty notices coming out in 2016 or a couple years down the road, you want to be able to quickly respond to that notice with good, solid documentation that was created kind of as you go, as opposed to trying to figure it out once you get the notice. So, you just need to understand what are the reporting requirements, what are the fee requirements, what are the due dates. Calculate every employer, large, medium, small, should calculate how many full-time equivalents they have. You never know when you're going to need that calculation. If you're clearly under the 50, you go to the shop. If you're around 50, there's all sorts of strategies about staying below 50 or just deciding that you're going to cover. I mean, you don't have to provide health insurance right now. There's no law that says you do. You do because it's good practice, it's competitive benefits, you want good people working for you. So nothing has really changed in that regard, but now this penalty and the provisions of the law make you have to think about it more. Just have one person who understands or is in contact with someone who understands and can help answer these questions as they go. There's going to be a lot of questions. There are going to be certainly many more regulations coming out, so you need someone who's kind of on top of it at your organization. One of the things we did at CliftonLarsonAllen, we like to think of ourselves as objective, where we don't sell health insurance. We consult with our clients, and one of the things that we've developed is a health insurance calculator. ESI means employee-sponsored insurance, so there's a couple ways you can go, and I don't expect you to understand this slide, but essentially what it does is it goes through the kind of the thought analysis that everyone on the phone needs to go through. You know, you need to look in the top left corner, how many people do I have? What is my coverage right now? In this case, it's $2,400, and the employer contribution is 30%. How many people do I have that I'm paying so low that they're going to go on Medicaid when this kicks in and they're actually going to drop off my plan? Below that, how many people do I have where I'm providing coverage that is not affordable to them? You should be able to calculate that today and figure out, all right, this is what my penalty is going to be. And then what would happen if I said, I don't want to provide health insurance, I'll pay the penalty, and I'll figure out another way to compensate my employees by either giving them raises, which would have to be grossed up for taxes, because if you give them money flat out, they're going to get taxed on it. You know, do I keep offering the coverage that I'm offering? Do I change my plan? On the right-hand side, it's kind of an analysis of comparing the three. You know, here's today's cost. It's basically $40,000, you know, however you want to look at it. The second column is if I offer coverage, what's going to happen? In the middle there, we kind of take a conservative approach to this calculation and say, all those people who are waiving coverage now, we're going to assume they're jumping back on your plan. I mean, I think a really good example of that is what's happening at UPS right now. I mean, they have over 100,000 workers, and they've basically said to people, if you have a spouse that's on our plan and they get insurance through their own company, they're going to get kicked off our plan. I mean, and the waterfall effect of that may be that all of a sudden people who waived coverage on your plan are going to jump back onto your plan starting in 2014 or 2015. So it's something to be aware of. We add it to this calculation. We have this on our website. It's available. There's a nominal fee for entering your information. The web address on CLA Connect /health reform will lead you there, and that's it. If you have any questions, we're right at 3 o'clock. So for those people who only wanted to take an hour with the webinar, that's fine. We're done. If you want to hang on and see if you have any questions, we'll wait for a minute or so. I have Nicole Fallon here has joined Harold and I. Nicole is an expert on healthcare reform in our healthcare area, one of the industry groups that CliftonLarsonAllen serves. So why don't we wait just a minute and see if there are any questions. In fact, while we're waiting, maybe what we should do is just talk about exchanges for a second. And Nicole can give us just a quick rundown on you know, if someone goes to the exchange, Nicole, if an employer goes to the exchange, does that mean that those employees are no longer eligible for credits?
I think the answer to that, especially if you're a small employer and you're using the exchange and the shop channel, so the channel within the exchange, to offer insurance to your employees, they won't be able to piggyback, let's say, the tax credits available to individuals on top of what you're contributing. So that part is clear. If you offer them an unaffordable plan, or if you're not subsidizing it enough to make it affordable, as the law defines it, that 9.5% or less of their income, they may be able to go through the individual channel of the exchange and apply for the tax credits, but they wouldn't be able to use your contribution and piggyback the tax credits on top of that.
Right. So, for example, even if you're not in the shop, if you're offering coverage for your employees, where you're paying like 60% and the employee pays 40% for single, it's good coverage. It's expensive coverage. They can still go to the exchange.
They can always go to the exchange.
Always go to the exchange.
The question is whether or not they'll be eligible for tax credits.
Right.
And if what you offer is affordable to them, that's going to disqualify them from eligibility for tax credits.
Yep.
But clearly, one of the decisions employers have to make when they're evaluating their benefits now is maybe my employees can do better in the exchange with or without tax credits. In the state of Oregon, for example, they found that as the individual market rates came out, the premium cost in the individual market portion of the exchange, those premiums are half what a employer can get in the group market. So if you're an employer now, your decision is I have to subsidize at least 50% just to be comparable to the individual market in the exchange. And, then if you have low-wage workforce, they could do even better by going to the exchange, and therefore maybe dropping your plan is a win for you and a win for them. So all of this requires different decision-making around benefits now.
So we have a couple questions. The first one is, if an employee has coverage through another source other than the employer, does the employer need to document that to avoid penalties?
The only thing that triggers penalties is that individual going to the exchange and getting subsidies. So if they're covered by their employer's, their spouse's employer's plan or parent's plan or what have you,
how would you document that then?
Well, sometimes what employers are doing, I know I have one client that their school district and somebody wants to waive the coverage and get the cash in lieu of the benefit, and the district allows them to do that, and they've required them to sign a waiver that they're using that money to purchase insurance or something like that, or have coverage elsewhere. I know there's 1,000 different arrangements when it comes to health benefits, let me tell you. And what I've said is you might want to make sure that now if somebody's waiving coverage for the cash benefit or for some other reason, and again, I'm not an attorney, but I would want the waiver to say, I have coverage somewhere else and it's not through the exchange with tax credits.
Okay.
That would be my preference, just to kind of protect myself.
You may not know.
The second question is, there was an exemption for informational W-2 reporting if the employer had less than 250 forms. Is that still the case?
So far, we've not heard anything new about that smaller employer group, the 250 or fewer W-2s, having to comply. We thought that was going to be a 2014 compliance.
2013 W-2.
Yeah, but so far we have not seen any additional guidance from the IRS on that issue. We've seen lots of additional guidance from the IRS, but just not that item.
So the next one, are members of a religious order, that is monks, nuns, and sisters, considered employees of the order?
Not generally. So it obviously depends on where they're working, but for purposes of this, normally let's say they're working at a school, you have them out in the world, or they're working at a college and university, or they're working in a parish. They're usually considered employees of that parish or the school. They're falling under the employee manual. They're expected to show up for work at a particular time. They're subjected to the disciplinary action of the school. They can be released. So normally they are considered employees, and I know they don't get a W.
But again, we're not attorneys.
Yeah.
Whenever you have a legal question like that, is this person an employee or not, seeking legal advice and documenting that legal advice, whether it's an email or a letter or whatever, and sticking it in your health care reform compliance file, I would highly recommend that, so you don't end up 3 years down the road and forget who you talked to that said, no, you didn't need to include it.
Yeah, NATRI might be a good resource for this also.
Who's that?
NATRI.
Which is?
The National Association of Religious Treasurers, but they kind of merged in with the legal group. So anyway.
Next question is, what are the 3 health care sharing ministries that are approved?
I don't know the name of them, and it is not insurance. You basically decide to share healthcare costs with a group of other people, and these are all, my understanding from reading their websites, they have a look and feel of evangelical organizations where you're basically asked to send checks to other people who have healthcare costs, and there's a mechanism they have for sharing those costs. It does not work like insurance, where you're paying a premium into anybody. You're basically being asked periodically to help pay for people's health care costs.
Next question. We are a church with about 20 full-time equivalents. Our ministers can participate in the ELCA Portico plan. Lay employees are not offered medical insurance. When I give notice to employees October 1st, can I use the form for employers who do not offer a health plan? And there's 2 forms. One is if you offer a health plan, one is if you don't.
Well, at this point, you do and you don't. I think you'd use both forms.
Well, the one if you do has a checkbox that says, I offer it to some people, and it makes you designate who you offer it to and who you don't. This issue, I see a correlation to what the union folks, employers who have union employees are facing, which is the union provides the benefit. So in the case that you're describing, it sounds like, maybe the priests and some others can get it through ELCA, but not directly through the church itself.
Well, the ELCA, the church itself is paying a premium to a multi-employer plan that is located at the ELCA. So they are paying health insurance. The church is actually is issuing the W-2. So the minister, in this case, the minister of the ELCA church is an employee of that local church. They are receiving health coverage that is being paid for by the church.
Right, and this is really just about what coverage the folks have. So if you, as the church, know what that coverage is for the individual, how much they're paying, those kinds of things, you definitely can fill out the complete form that you offer insurance, and you would check the box on the second page that said we offer it to some, and designate who you offer it to. The third page of that form is optional for all employers to fill out, and that is really more employee specific. This is the coverage that this person has access to, et cetera, et cetera.
Okay, next question. We are a Bible camp. We have 60 seasonal staff that work full-time and 12 full-time year-round employees. How does that work for the 3 months you're over 50 and the rest of the year you're not?
Okay, so 3 months out of the year, 3 months, 30 days, that's 90 days. So those folks that work just those 3 months can be excluded from your account because they work fewer than 120 days. So for the purposes of determining whether or not you're a large employer, they can be excluded. So if there's, how many did you say?
60 seasonal staff and 12 full-time year-round employees.
Okay, so the 60 can be excluded because they work fewer than 120 days. So you have 12 full-time people, you are considered a small employer.
Great. What are the differences between the employer notice required by 10.113 for employees located in multiple states?
Okay, so the U.S. Department of Labor issued a model notice that you can use in any state. I know at least for the state of Minnesota, and I suspect other states did this as well, where they have a state exchange. They may have their own model notice for their state. Either model notice will comply. The other thing to say that I know after we sent out our e-flash to clients and friends, the Department of Labor was kind enough to issue a frequently asked question response that said there will be no penalties for failure to comply. So my advice has been, I think there's still benefit to providing this notice to your employees because basically you're telling them, hey, there's a health insurance exchange out there. It may present some more affordable options for you. You may be eligible for some tax credits. It's worthy of exploring. It's just information. And since there's model notices, grab one, use whatever one works best for you.
Next question. We have a half-time employee who we offer insurance to. The cost for that employee is more than the 9.5%. Will there be a penalty for us for that employee? All other employees who work more than 20 hours per week have insurance rates lower than the 9.5%. What do you suggest we do? We're a small employer.
You're a small employer, so you are not subject to penalties. If you were a large employer, in that case, you only pay penalties for full-time employees, not full-time equivalents, full-time employees, because again, penalty is tied to an actual body going to the exchange and receiving subsidies, not an amalgamation of bodies, but a body.
And this employee is not considered a full-time employee because they're only working half-time, not the 30 hours per week.
Next question. My religious order's lay employees are covered by health care insurance as part of their benefits. Our members, monks, however, file claims through a third-party administrator. We are basically self-insured until they're 65 years old and go on Medicare. Are the religious members considered employees? What documentation would be needed for those religious members over 65 years old?
Certain religious members may very well be considered employees if they're working for the order.
You know, the other thing that I would say in this particular set of circumstances is that they have coverage prior to 65, whether or not you're providing it. So they've got it. It's not through the exchange. They're not getting subsidies, so no penalties. In the event that they turn 65 and you're just letting them go to Medicare, Medicare is considered minimum essential coverage, and by virtue of the fact that they're eligible for that, they can't go to the exchange and get subsidies. So again, the practical application or practical situation is that you would not be subject to penalties in either one of those circumstances.
But it is a self-insured plan, and you should talk to your administrator about the fees that are associated with self-insured plans, because there are fees associated with self-insurance.
So the last question we have, and these have been really good questions. I appreciate it. We're already 12 minutes over the hour, but let's get to this last one because I think it'll be applicable to many on the phone. If an employee chooses not to get insurance through the employer, even though it's offered, and they go out to the exchange, will that employer be penalized?
Yeah. Again, only thing that drives the penalty is whether or not they get the tax credits or the exchange subsidies. So if you have offered them coverage, it is affordable for them. They go to the exchange. Even if they got tax credits up front because they lied on their application or whatever, that all gets reconciled on their individual tax filings. And ultimately, starting in 2015, the information return that employers will be providing to the IRS about who their full-time people are and what they offer.
But it is possible that you can offer unaffordable care for individuals, depending on how much money they make, how much money it would cost them, and they could go out to the exchange, and if you're a large employer, you could have a penalty. But again, you get the penalties. You know, it's a complicated deal to figure that out, but
I mean, the safe harbors are there to protect you on the affordability quotient so that you can have some predictability up front. You know, look at W-2 wages, figure out what's affordable, use the federal poverty level safe harbor, which is really straightforward, not easy to meet that requirement. And the third safe harbor, you can even use hourly wages to kind of calculate.
Okay, that's it. We really appreciate your time for joining us on the webinar today. As a follow-up, we're going to send you a link to the webinar recording and the presentation slides within 10 business days. You will get a survey if you could respond to that. As Harold mentioned, we base our future education on the input we get from our current participants. So thanks for your participation. You may now disconnect. Have a good day.